In West Virginia, there is a double threat on the public health front. The not so very encouraging news starts with COVID-19. The Mountain State, once a leading example of getting residents efficiently and quickly vaccinated, is now struggling to keep up the pace. But that's not all it does mean.
Yeah, so on top of an increasingly dire COVID situation in West Virginia, the state's also dealing with drug overdose rates that are worse than expected. WDVM Stephen Cohen is reporting from the Eastern Panhandle tonight, where he spoke with officials about both problems and what's being done to get things back on track.
Addressing a dual public health crisis in the Mountain State.
The Center for Disease Control and Prevention says no other state has a lower booster participation rate to fend off coronavirus infection than West Virginia. What you say? There's baby dog and cash prizes and pickup trucks to get those needles in our arms. That really, pardon the pun, can only move the needle so far.
You really got to get into the communities and really educate and have that solid message from everyone with the facts and the evidence base.
Health officials will intensify their booster sales pitch. Meanwhile, the CDC also reports that West Virginia has the highest fentanyl overdose rate in the entire country. West Virginia is one of only 5 states to experience an increase exceeding 50% over the past year. And needle swapping isn't helping things.
Which we've had huge hepatitis rates in this state. We've been number 1 in the nation for more than a decade for hepatitis B and C rates. And prior to the pandemic, we had a huge hepatitis A outbreak in West Virginia related to IV drug use.
And Gray may work in the state's fastest growing county, but with that comes a dubious distinction.
Fentanyl is a huge issue, and especially in Berkeley County. We are one of the top 10 counties in the nation, not the state, in the nation, for the amount of fentanyl that is in our county.
Berkeley County is not far from Washington, D.C., which has the nation's second highest fentanyl overdose rate.
And public health officials here in the Eastern Panhandle are first to concede their resources are stretched really thin. Reporting from Martinsburg, Stephen Cohen for WDVM 25.
All right, Stephen, thank you. So along with West Virginia, the other states experiencing such dramatic spikes in fentanyl death are California, Tennessee, Louisiana, and Mississippi.